The eyes are on the Jersey Shore. Hello, everybody. I am Vin Ebenu inside the Town Square Media Jersey Shore newsroom in downtown Toms River. And my guest today is Dr. Ken Sable, the regional president for Hackensack Meridian Health Southern Market, which oversees Jersey Shore University Medical Center, Ocean University Medical Center, and Southern Ocean Medical Center between Ocean and Monmouth counties. And the topic of discussion today is unfortunately still the COVID-19 pandemic. And certainly, Dr. Sable, you and I have, talked a lot in the last couple of years, hoping for that conversation that you and I could have one day that's not COVID related. And maybe this will be the year in 2022, but certainly a lot going on of late with the pandemic and the Omicron variant of the last couple months and everything. So before we get rolling with a series of discussions and focal points here, I just want to thank you for taking out some time in what it is a very busy time.
Well, thank you, Vin, and Happy New Year to you as well.
Let's make 2022 a better year than the last couple. We've slowly been making progress. But after with the Delta variant, we thought that was going to be, pretty bad. And it certainly was, with cases and deaths and hospitalizations and everything. But who knew that there was going to be another variant? And, I'll let you correct me if I'm wrong here, but it's like with the Delta variant, my understanding of it was more deadly. But the Omicron variant is certainly more transmissible and more easily spreads from person to person, even though it's, I guess, not in some cases as fatal here. But with Delta and now Omicron and cases going up, maybe it's more people getting tested as well. What is your kind of feel, your diagnosis for what's going on, particularly with the Omicron variant right now?
Sure. So, I think you're accurate in that the Omicron variant is generally 3 times more transmissible than Delta, but 1/3 less severe. So, sometimes people are saying, well, it's less severe, so you don't need to worry about it. The problem is, because it's 3 times more transmissible, the absolute number of people, the denominator of people getting infected, is so much greater that even though it's 1/3 less severe, we're seeing a lot more absolute number of sick patients. So it's a little bit of a misnomer to say that it's less severe because it's so contagious that so many more people are getting it. And as a result, we're seeing a lot of very, very sick people as well.
Now, as we begin the new year, certainly cases still going up. I mean, the amount of positive tests that we're seeing per day and per week, not just Ocean and Monmouth County, but across the state of New Jersey right now, is kind of eye-popping, numbers that we haven't seen since maybe the beginning of last year, and certainly 2020 in some cases, with kind of the record amount here. But how overwhelmed are hospitals right now in dealing with the current state of the pandemic, and especially with this Omicron variant kind of raging on right now and infecting so many people?
Yeah, that's a great question. First, let me just say there's big differences between wave 1 and wave 2 that we're in now, between the Delta initial wave and the Omicron wave that we're seeing now. Not only, one is more contagious and less severe, but also where we were in terms of preparedness. So if you remember, in the beginning of wave 1, we were talking about was PPE, personal protective equipment, ventilators, ICU beds, and did we have enough of all that? Fortunately, we've planned with great help from the state and the federal government. PPE is not a problem. We have plenty of masks and gloves and gowns and eye protection to make sure that we keep our team members safe. I would say what's probably more, most different in this wave is staffing. And mainly because this is so contagious, we're seeing that more and more of our team members are getting infected and are unfortunately having to go out of work. We're grateful that the CDC has recently changed their policy that if you're positive but asymptomatic, the quarantine period is only 5 days, not 10 days. So we're getting people back to work, obviously still protected with PPE and so forth. But that's sort of a big difference that we're seeing, this time compared to last time. The patients in general are not as sick in general, but we're overwhelmed by, as I mentioned earlier, just the number of patients. And so, one of the key messages that I want to make sure people understand is if you're only coming in for testing, try to avoid the emergency departments for testing. We have a lot of other places that can do testing. We're setting up tents around many of our hospitals in some other locations in Monmouth and Ocean counties to help people. But if you don't need the emergency department for acute, care, try to avoid it right now and get testing elsewhere.
There was certainly a lot of scrambling. You hit on it the last couple of years, especially early in 2020 with the pandemic, with trying to set up locations to get tested and then eventually for people to get vaccinated and everything. And certainly you hit on a point that I also want to touch on with just staffing with nurses and doctors and everything. So I know some solutions are in the works that you discussed as well, but do you think are any challenges with sustainability or durability of the current staff with these hospitals to keep up with the amount of cases going in? Certainly compared to a couple of years ago, it's more people vaccinated and boosted at this point, so more protection available. But do you see any more challenges with where things are currently at here at the beginning of January with being able to provide those tests, those vaccines, and certainly with people coming in who are seriously ill and feeling the side effects of whether it's one of the variants or just the coronavirus altogether, with taking up the hospitals? And then on top of that, certainly anybody coming into the hospital for non-COVID related issues.
I think that again, there are some differences with wave 1 and wave 2 here. And again, I'm calling wave 2 the Omicron, although we've had multiple waves in between. But I think one of the keys is that this Omicron variant seems to be moving really quickly. In fact, I think in the middle of December, we were in the 10% range of Omicron dominance throughout the state. And now it's 70, 80%. So it's moved very, very quickly. The models are projecting that we're going to peak probably in the next week or so. Again, unlike the Delta variant, which was much slower moving and took a long time, we hope that this will kind of come through very quickly. But really, it's about getting prepared and being able to manage this surge up as we continue to try to get towards our peak over the next week or two. Right now in New Jersey, there's about 5,000 or so patients admitted in the hospitals. We're projecting that number based on some of the modeling that's done by the Department of Health and some of the national models, that we're going to actually hit about 10,000. So that means we're going to double potentially between now and the next 2 weeks or so, until we sort of peak and get onto the other side of that curve. So we are concerned about staffing. Remember, Vin, and I want to just again have a shout out to our team, give a shout out to our team and all of the healthcare providers out there. They're tired. They are stressed. They've been at this for 2 years. As resilient and dedicated they are to their profession, they're tired. They're working hard. They're mentally drained. They're physically drained. And we just need to get through this and hopefully get out on the other side in a better place. But I do think that as we hit our peak over the next week or so, hopefully it'll be quick. We will hopefully get through it. We have a number of staffing models and things that we're doing to try to prepare, along with space for capacity planning. But hopefully we'll be in a good place in the next couple of weeks once we ride this storm out.
Do you feel that additional hires would be necessary at any point, either right now or perhaps in the long term this year, with nurses, doctors, whoever is, in school at the moment, and, once they graduate, boom, there you go. We're trying to bring back retired healthcare professionals to help keep up with the pace, so that, to your point, with the staff that's there now, so that they're not overworked and overtaxed and kind of drained and, working 12, 16-hour shifts or whatever the case may be. Would additional hires help, or bringing back retired workers help?
All the above. We'll take retired workers who want to come back. We'll take anybody who's obviously meets certain criteria. We're always hiring. We're always looking for more people. The problem is there's just not a ton of people out there. There's definitely a shortage. The entire pandemic has caused many people to leave the industry, not only in our area, but of course across the country. So we're seeing shortages in physicians, in nurses, in patient care technicians, in housekeepers, and people who can deliver food. We're competing against other companies. It's not just limited to healthcare. We're competing against the Amazons and the Chick-fil-A's and others who are also hiring the same people. So, we're trying to be aggressive. We're trying to do everything we can. We've contracted for, I think, 1,000 agency nurses a few months ago, anticipating this, and we're in the process of trying to onboard as many of those as we can. We're also looking at working through the state to titrate some services down. So, for example, very low level elective surgeries that are, not necessarily time sensitive or medically emergent, postponing those for a 2 to 3 week period to be able to redeploy that staff to give us additional capacity. So we're working collaboratively with our partners in the state, with our other partners and colleagues in the industry to manage this collaboratively.
You hit on a couple points as well I want to revisit too, and I'm sure it's not just your hospitals all over the state, with people going in for COVID tests, COVID vaccines. That's just adding additional foot traffic in hospitals as well. And to help clear up any confusion that the public may have about getting tests and vaccines, especially tests, with, I think, over the last month, with the amount of the demand for tests, just, here, there, and everywhere across the state, people are looking for anywhere they can go for tests, number one, and then certainly having to wait for the results of that test has certainly been lengthened out here. But what is it about COVID tests and vaccines at hospitals that you want to try and help clear up for people looking for tests and vaccines? Sure.
So let me start by saying, we still strongly encourage everybody to be vaccinated. I can tell you that 3/4 of our hospitalized patients, we track this every day, are unvaccinated. 25% are vaccinated, but some of them are not boosted. So your best bet in terms of protection is vaccination and booster. If you're 6 months out or more from your second shot or your first shot, if you got the J&J, go get a booster shot. And even if your antibodies have dropped, you're still less likely to be hospitalized and less likely to die if you've been vaccinated against either Delta or Omicron variants. Our medical centers are providing the COVID vaccine for ages 5 and older. Our urgent care centers are providing COVID testing. Both are by appointment. Anybody out there can visit Hackensack meridianhealth.org for info, also can schedule appointments right there. And people can also visit the state's website to schedule COVID testing at their locations. And that's covid19.nj.gov/pages/testing. It's best for people to get to visit our urgent care centers or the state sites to receive COVID testing. As I mentioned early on, if you need the emergency department, obviously for symptoms, obviously use it. But if you're only coming there for a test, we would strongly encourage you to seek out testing at an alternative location. And we are currently working to stand up many sites, tent sites, and others around our hospitals to offer that to the public as well.
As we close up here, I want to certainly focus on the variants, the COVID-19 virus overall here. What does everyone need to know about this latest variant, even the Delta variant that's still circulating out there as well? Where are we with the pandemic right now? Are there any signs of hope that this could start to, at least the current part of this wave, could start to slow down a little bit soon, and then at some point this year that we could be, as a society, in a much better place than we are now with the amount of people getting infected and hospitalized?
Right. I mean, I would say, I mentioned this earlier, that we're seeing a rapid pace of the Omicron variant, and that actually bodes well. The other thing that bodes well is that it's actually highly contagious, but less severe, which means a lot of people are going to get it. So there are theories out there that this could get us to herd immunity. Again, I think the goal for everybody and for our public is, if you get the virus, we don't want people to be sick enough that they have to go to the hospital, and we don't want people to die. And therefore, again, I can't stress enough how important it is to be vaccinated. Interestingly, Monmouth and Ocean counties had a lower vaccination rate than some of the northern parts of the state. And as a result, we saw Delta sticking around longer in the Monmouth and Ocean County areas than in the northern part of the state, where Omicron became the dominant variant very, very quickly. We're seeing that catch up now in the South. But again, it's all about, the more we can get people vaccinated, obviously children as well. We now have approval to give, the booster shot to, 12 to 15 as well. So that's another, area of protection. That's going to be critical. So vaccination still remains our best hope. The other reason to get vaccinated is, people will say, well, what's the big deal? It's not that, severe. But when all these people are coming into the hospital and flooding the hospital, it makes it harder to take care of the legitimate patients that are sick for heart attacks and strokes and trauma, because the hospital beds and the resources are taken up by people who have COVID. The last point I want to make is there's a lot of discussion about monoclonal antibodies. And the traditional monoclonal antibodies like Regeneron and others that we've been using have proven not to be effective against the Omicron variant. Sotrovimab is a new monoclonal antibody by Glaxo, which just got approved and came out, but it's still very, very short supply, and there's very, very strict criteria to get it. So if you do get COVID with the Omicron variant, presumably it's Omicron. Remember also that the symptoms of Omicron are a little bit different than Delta. Rather than the high fevers and the loss of taste and smell, it's more like a common cold. It doesn't sort of penetrate the lungs as much as it does sort of the upper airways. If you're not that sick, just stay home, quarantine, don't run to the hospital, and you most likely don't need any further treatment. If you are meeting certain criteria, if you're over age 65, if you're unvaccinated, if you have comorbidities that may qualify you for the monoclonal antibodies, which we're trying to get more supply of, speak with your doctor and see if that can be arranged. But all in all, most people, if you're vaccinated, and you get this variant, you'll probably be okay. Just take supportive care and quarantine, and hopefully you'll get better.
Dr. Sable, I appreciate you taking out some time. I know things are busy, to say the least, and a lot going on with the current state of the pandemic and within the hospitals here at the Jersey Shore and Ocean and Monmouth counties alone. And I think you made a couple of great points just on the variant's effect, including Delta here at the Jersey Shore, and then certainly statewide as well, with where people can go for testing, where people can get vaccines, and the importance of getting a vaccine and then getting the booster shot when it's your time. Thanks for taking out some time to explain all this and to kind of share where things are at with the hospitals, and, offering some glimpses of hope, in the short term and in the long term. And I know we said it at the top as well, but hopefully 2022 will be the year where, we reach that point as a society, as a state, to where we say, okay, things are a little bit more calm, seas are calm. We could try to find whatever that new normal might be.
We all need that, and from your lips to God's ears, and let's hope we get there in the next several weeks. But thanks for your time, Vin, and great speaking to you as always.
Excellent. Thank you again. That is Dr. Ken Sable, the regional president for Hackensack Meridian Health Southern Market, which oversees Jersey Shore University Medical Center, Ocean University Medical Center, and Southern Ocean Medical Center here in Ocean and Monmouth counties, with all the latest on the COVID pandemic. Thank you to Dr. Sable. I am Vin Ebenu, and thank you for watching another episode of Eyes on the Jersey Shore.